Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I have something very, very special in store for you. Now, anyone who's been watching my content for any amount of time, you know that I am a family nurse practitioner. I specialize in pediatrics. But what you don't know is the person who got me to where I am now. Now, yes, I do have formal training as a family nurse practitioner, but all of my clinical knowledge, my know-how, my hands-on training has come from a good friend and mentor, Dr. Regine Bataille. I'd like to introduce you guys to her, Dr. Regine Bataille. Dr. Bataille, welcome.
Thank you for having me.
Thank you for being here. I'm very good, thank you. So guys, this is Dr. Regine Bataille. As I said, she is the founder of MD Coach Now. The reason that we're doing this video, as I said, all of my know-how comes from this woman. She has forgotten more than I'll ever learn. I'll tell you that right now. Dr. Bataille, can you please tell me and the audience about MD Coach Today?
MD Coach Today is a company that I just created last year. It started from an interest that I've been having, especially with not only children, but teenagers and adults with ADHD who've been having so many issues into their daily life.
Yeah, we've been seeing a lot of ADHD patients.
Yes. Here, we've been seeing a lot of ADHD patients in the practice, and some of them were treated with medication, but even when some of their symptoms were controlled, they still have problem with time management, with organization, with a lot of executive function that basically the medication was not able to address.
Okay. We've been hearing a lot about ADHD and the science and the neurology of it. Can you explain that further and just help us to get a better understanding of the neurology of ADHD?
Yes, there's been a lot of studies, recently we're learning more and more about ADHD. Now we definitely know it's a biological problem.
Okay.
It's also behavioral, but the main cause they believe it's neurological and also genetic. For people who don't know about ADHD, it's a condition that is characterized by different patterns of mostly inattention, lack of focus, impulsivity, and in some cases, hyperactivity. In the past, they used to think that hyperactivity was the main aspect of ADHD. That's why so many girls and so many women were not diagnosed because they didn't present those symptoms and they didn't think they could have ADHD, especially if they were smart, if they were doing okay in school. But they had other difficulties.
That's so interesting that you mentioned that, because usually when someone thinks of ADHD, the first thing that comes to their mind is behavioral issues. And so the fact that you pointed out that there absolutely is a neurological aspect of ADHD, this is something very important for us to know and for us to understand. Thank you so much. So can you go into a little bit more detail regarding the neurology and the brain function and that science behind the ADHD, as far as, the frontal lobe, neurotransmitters and things like that?
Oh, absolutely. We know now that most of the behavioral aspect of ADHD come from the fact that part of the brain involved, it's mostly the prefrontal lobe, the cortex, okay. That where all the organization skill, the attention, emotion, planning skill, being able to think long term. Okay. All this come from this area. So this part of the brain regulate attention, behavior, and also emotion.
And that's interesting because, especially in children, that part of the brain is still actually maturing. It's not fully functioning.
Actually, we found out, is so interesting that you talk about that. We found out that, it's something that happened very slowly. And even in teenagers, it continues to happen even in adults. and they think even up to 30 years old.
Wow.
Some adults don't have a mature cortex, the frontal lobe. So that's explain why, when we think the 13-year-old is an adult,
Not
some
so.
of them, not so much. A lot of them have difficulty of problem solving, with impulse control, so they can get in trouble because of that. Other aspects that are involved are the neurotransmitter system. We have the neurotransmitters. When we're thinking of norepinephrine, we're talking of dopamine, we're talking of serotonin, all those chemicals that help with the transmission of signal between different parts of the brain. So they basically transmit signal between the neuron and all those things. So all the response action, when you when you see something, for example, in the occipital region, that's where all the aspect, with vision. So you see something and you send a signal to your brain in the front to actually take an action. But normally in a mature brain, what happens is that you think of the consequence of this action, you think about it, and you control your impulse, and you can plan it, and you do it when it's appropriate. But somebody who does not have this maturity, and especially with ADHD,
that
or
forethought is
ADHD,
missing.
it's missing, and they just act on impulse. That's what happened with a lot of those kids. Yes.
Okay, great. Thank you so much. Thank you so much for that explanation. So my next question is about neuroplasticity of the brain. How does that correlate, or how is that associated with ADHD?
Absolutely, I can talk about that. Neuroplasticity refers to the brain ability to change and adapt as a result of experience. You learn something, and your brain can change and adapt to that circumstance. It can reorganize itself and form new neural. That's what happens sometimes after accident, when the brain can actually learn new skill and recover from injury. That's why in young people where this is actually more adept, they can actually relearn to speak. That's what happened after a stroke or any type of injury.
So what would be the deviation, for example, in a person who would have ADHD? What would be that difference? In this case, because the synapses are not working properly, so usually they cannot do it. It's not happening by itself. Okay.
So that's why they need therapy, and they need coaching to be able to do that.
So I'm so happy that you mentioned this. You mentioned two things. You mentioned therapy and coaching. So can you please explain to me how MD Coach today, how that will be beneficial for not only patients who have ADHD, but their guardians, their caregivers, those who are closest to them or in close proximity? How would, first of all, what are your services? What do you offer, and how would it be beneficial to this type of population?
I created MD Coach today after getting trained for a long time on this aspect of the treatment of ADHD.
And not for nothing, I didn't think Dr. Bataille could get any more training than she's already had. Like, I'm not even joking, guys, when I tell you that this woman is a wealth of knowledge. So just the fact that I have to commend you for that, Dr. B, and this is one of the reasons why you are and will continue to always be one of my mentors, is because one of the things you've taught me is that you never stop learning. There's always something to learn, and there is always a way that whatever it is that you're doing, you can do it better. Always try to perfect your craft. So I'm sorry, I didn't mean to interrupt you, but you guys who are watching, I just wish that I could put into words the gem that's sitting right here next to me, and what type of wealth of knowledge that is right next to me. But yes, so please go ahead, continue with MD.
Yeah, now that you make me blush, I have to continue to talk about coaching. Like I said, it's not about me, it's about helping really people who have these issues and don't know where they can get help.
Okay.
Coaching, it's have been a bit there for about 20 years since they've been. Some people that are interested that have been studying it have been trying to make it accessible to more people.
And 20 years, that is relatively new when you're speaking in aspects of healthcare and medicine. That's very new.
Because for many years, all we knew about treatment of ADHD was basically medication.
Correct.
And not everyone can take medication. Not everyone wants to take medication. There's certain aspect of the symptoms that are usually treated with medication, but some other aspect of daily life, of organization, focus, boosting the confidence, learning to be self-reliant. All those things are things that you can get through coaching, because what coaching does is connect with the client, with the person, to have them discover in themselves how they can make the changes, create new routine, create new habit that's going to help them get better organized, get better focus. They learn how to use nutrition to improve their symptoms. They can learn how to use exercise, because exercise is very important to help people with ADHD feel better, get better, be more focused. All this, it can be done with coaching.
So Dr. B, thank you so much. You talked about neuroplasticity. So I want to know, what would be the relevancy of neuroplasticity for ADHD?
Neuroplasticity, this aspect of the brain being able to create new connection, is actually the most hopeful outlook that we have recently for ADHD. Because we know that first we can treat with medication, but with coaching, we can help somebody for those therapy can enhance executive function. Like I told you, executive function, it's something that happen in the prefrontal cortex, and that's involved in planning, organizing, time awareness, self-control, even moral judgment, thinking what's right or wrong. All this is in the front there. Attention. And there's a lot.
Can I stop you really quick? Because there's something you mentioned about all of these actions for the right prefrontal cortex. So I remember you saying it before, so I just want to double check. This is something not only for children, but for adults as well.
For everyone.
So this will help them during work,
yes,
daily living. Okay.
Daily living. Everyone basically who have ADHD, and you can have ADHD at any age. ADHD is not something for children that disappear as you get older.
I think that's a common misconception that a lot of us have.
It is. A lot of people think that way. But if you have, because it's neurological, it could be that basically you're unable to produce all this or regulate the epinephrine, the serotonin, and the dopamine. As you know, dopamine is the hormone that make you feel good, that gives you that push, and
the feel-good neurotransmitter.
Yes. So people, who lack this are always looking for it, and sometimes they look for it in the wrong place because they're looking to get it really fast. So they might start, driving really fast, and they can get into accident. So it's very important to kind of teach people, and in a way that they develop new connection that are basically more helpful for them to be successful. So instead of just going and listening to that voice that say, let me have some dopamine right now, they learn healthy ways to get that dopamine, like exercise, like getting taking a cold shower sometime, and many other ways that you can improve dysfunctions.
Well, I think I would benefit from your services because I get that shot of dopamine whenever I have a slice of pizza, right? So I need, I think I get your services as well.
One of the problems with ADHD. We tend to eat very poorly people with ADHD. So we help also, making this kind of the decision making, thinking of consequences, what might happen later on. Because with ADHD, thinking about the now only. They know the now and the not now. So they're not worried at all about the not now.
Gotcha.
Basically the now. What I need right now is to feel full. What I need right now is to feel good. What I need right now is to find something interesting to do. I cannot just stay there and feel bored. No, I cannot be bored. I need to be doing something. That's why they play video game a lot. They can spend hours. They have no problem with attention because it's not really a level of no attention. It's a dysregulation of the attention. They can pay attention to too many things at the same time. So they have too many thoughts racing in their head. So they need to find something that's basically give them that quick reward, really fast. That's why they have all these issues. So this intervention with coaching lead to reduced symptoms and improvement in the function of in daily life. So you develop more effective pattern of thought and behavior from coaching. So that helps you, that increases the potential of the brain, because if the brain can do so much better and improve your symptoms, so why not do it?
Absolutely. Okay. Would you mind just providing just a quick walkthrough of someone with ADHD that would be interested in your services? What would it look like very quickly upon contacting your company or contacting you?
Okay. Coaching for ADHD use different technique that basically I had to learn and I had to understand very well, so I to apply to practice it. So if somebody who basically wants to improve their attention, their focus, and work with their emotional dysregulation, because we know that can be a problem with ADHD, what they can do if they contact my company, I have a website that they can contact.
What's the website, please?
It's mdcoachtoday.com.
mdcoachtoday.com, okay.
Yes, and there's a lot of information there, actually about ADHD. They can read about it, they can see how they can be helped, and also they can contact us from there and we get back to them to we basically, the first thing we do is a free discovery call, where basically you don't sign any contract. You basically contact me. We schedule a session where we can see if it's going to work for you, if it's going to be a good fit, or if we can work together.
Okay, I want to stop you just for 1 second. So guys, something you said to me that was very interesting. You said a quick discovery call. And what jumped out to me was that word discovery. Now, guys, how many times have I said to you, when it comes to healthcare, when it comes to nursing, when it comes to medicine, your first action is assessment. You need to get information. And what did she say? Discovery. So the first thing that she's going to do, or please correct me if I'm wrong, but from what I understand what you're saying, the first thing you're going to do is get information. You want to put something together that is tailored specifically for that person.
We basically want to do it individualized.
Wow.
It's very important, because when you meet one person with ADHD, you meet one person with ADHD. It cannot be a one size fits all.
You hear that?
You need to have somebody who's going to be a partner, somebody who's going to work with you, to support you in your journey to improvement, to set goals and reach those goals for success.
Thank you so much for that. That was something that just stood out to me that I really wanted to bring to your attention, you guys. So I have a question for you, Dr. Bataille. What would your last words or your last communication with this audience in regards to the ADHD life coach? What is the takeaway that you would like every single viewer to have?
I believe everybody who have ADHD would benefit from a life coach that specializes in ADHD, that can give you the information, have you understand your symptoms better, and understand how you can control them, how you can improve your, the function that come basically from your brain, that so you can do better, you can have better relationship, you can sleep better, you can work better, you can study better, improve your quality in life, and for the family as well.
For the family as well. Okay, guys, so you heard it here. To contact MD Coach today, the email address is R as in Regine, B Bataille, this is Dr. Regine Bataille, rb@mdcoachtoday.com. Once again, that's rb@mdcoachtoday.com. Guys, thank you so much for watching this video, and you guys will catch me and hopefully Dr. B on the next video.